Good afternoon, everyone. Welcome, and thank you for joining us for this workshop, Building a Culture of Health Through Cross-Sector Collaboration. I'm Lenny Eliason, Commissioner from Athens County, Ohio. This afternoon, we'll be joined by a distinguished panel to explore county experiences in fostering cross-sector collaborations to impact health in their communities. I'm joined on stage with Julie Willem van Dyke, Associate Scientist and Director of the County Health Rankings and Roadmaps Program. Julie will moderate the panel and talk about the importance of elements of collaboration and why it is so important to our work. Also joining us today are Melvin Hauser, Auditor from Potawatomi County, Iowa, Patricia Harrison, the Deputy County Executive from Fairfax County, Virginia, and Kevin Schiller, the Assistant County Manager from Washoe County, Nevada. Julie, let's just start the session.
Great. Let's see. Can you hear me? Thank you so much, Lenny, and thank you for all your leadership in building healthy counties throughout the years. Really appreciate it. So thank you to all of you for hanging in there to the last session of the day. I think you're going to hear some really interesting examples of how to do this work in communities, as you heard, across the nation. So my hope is that there is something special for each of you to take away from this presentation. So what we're going to do is I'll make a few introductory remarks, and then each of our panelists will spend about 10 minutes telling you about how they're making cross-collaboration work in their communities on some of them on very specific topics, some of them on a variety of topics in their community. Then we'll have an opportunity for all of you to engage with the panelists, to ask questions, and to join the conversation with us. And then we'll do a final wrap-up, and it'll be time for you to get on your way for the evening's events. So just to ground us for a moment, when we think about what creates health, how many of you have seen this picture before? A few of you, okay. Great, so some of you for the first time. So this is the model of health that we use when we rank the health of counties at County Health Rankings and Roadmaps. And so what I think is really important about this, particularly for our conversation today, is you see at the top of the picture, what we all want is positive health outcomes in our communities, right? We want people to live long and high quality lives. And in order to get long and high quality of lives, we need to look at everything you see in this picture in the blue boxes, or what we call the health factors that drive how long and how well we live. So we need to look at things we traditionally think about when we think about health, like access to and quality of medical care and creating environments where it's easy to make positive choices about healthy eating, active living, not using tobacco, moderate drinking, safe sexual activity. But we also have to look at social and economic factors because they are major drivers of health. You'll see you probably can't see in the back of the room, but each of these are weighted, and social and economic factors are weighted 40% towards what creates health, whereas medical care is only 20%. So we need quality schools, we need good jobs, we need safe neighborhoods, we need people feeling connected to each other. And then finally, we need a positive physical environment. We need clean air, clean water, we need good housing, good transportation systems, and it's all of these things together that create health. Now clearly, when you look at that picture, a couple of things emerge for me. Number one is, I'm a nurse, but please don't make me as a nurse or my physician colleagues be responsible for everything on that list. Because it takes all of us in the community working together in order to make all of those things happen simultaneously. And second, why County Health Rankings and Roadmaps has seen it so positive to work with NACo over the last 5 years is when you look at that list and think about all of the areas that you touch as county leaders, as leaders of county government, whether in an appointed or an elected position, almost everything on that list is touched by county government. So really critical. So that's what we believe, is it takes everyone in the community working together. Now, once again, you as county officials don't want to hold the whole bag all by yourselves either. You would like your healthcare partners and your education partners and your investors and business community and your faith partners and your healthcare system to all come together to make sure this happens. And that's really what our panel is going to talk about. Now, sometimes when we talk about coming together in collaboration, we act like it's really easy, like, just sing Kumbaya and we'll all be really happy together. But that's not necessarily true. So I want to do something for a moment that helps you see what is really necessary in order to do cross-sector collaboration really well. So you're going to think I'm a little nuts for a moment, but just play with me. I want everyone to stand up, including the panelists. And on the count of 3, I want everyone to face where Dallas is. Okay, so you got a moment to think, where's Dallas? 1, 2, 3, go. Okay, we're a little mixed up. So I want you each to pick a partner, pick someone standing by you, just 2s and 3s, and talk with them about where you think Dallas is. Which direction is Dallas? All right, you can sit down. Are there any judges from Dallas in the room who can confirm for us? It is southwest, that is correct. So, here's what we were just illustrating. What I believe about cross-sector collaboration is you need 3 things working really well together, and I bet you'll hear this in much of what you hear today. You need direction. So you need a shared understanding of what your common goals and strategies are. Our common goal in that little exercise was to find out which direction Dallas was. One simple thing to do. But when you do this kind of cross-sector work, you need to know what direction you're heading. And then you need alignment, because we are still figuring it out. These women are committed. All right. So you need alignment. You need to know that all your resources and activities are heading in the same direction, towards that point that you set out. Now, if we had tried to go to Dallas the way we were all pointed the first part of that exercise, we wouldn't have gotten there very quickly as a group, because some of us would have been wandering the universe of the United States for quite a while. And then finally, you need commitment. That's what you just saw here, commitment. We're going to get this right. We are going to put our own needs aside, and we are going to be sure we know that we are doing everything we can do to get to that direction, that vision, that goal that we want. So think about those 3 things: direction, alignment, and commitment. And as you hear each of the panelists speak, I think you'll hear examples of it, and you'll also hear examples of some other frameworks you can think about that you can take home to use when you work on cross-sector collaboration. So we're going to start at the end of the table, and Melvin Hauser from Potawatomi, Iowa, will begin our discussion.
Okay. Thanks for saying Potawatomi right the first time.
Midwesterner.
All right. I've only been a county auditor for 6 weeks. Previous to that, I was a county supervisor for 16 years and had done a lot of work in the county and in the Southwest Iowa and local regional food system work. I'm a farmer. I grew up, I'm still living in the same farmhouse I grew up in, so you kind of get a perspective of where I'm coming from. And I've seen how agriculture and our food system has changed in the last 60 years, and even had been changing even before I was born. So Megan from NACo asked me to come and talk about SWFI, which is the Southwest Iowa Farm Food initiative, which is also a RIFI-SWIG. How many of you know what a RIFI-SWIG is? Is a regional food system working group. And about 10 years ago, the Leopold Center for Agriculture wanted to have these RIFI-SWIGs started throughout the state of Iowa to increase the production of local foods. And we all know what benefit that can be to your local community. So SWIFI is a RIFI-SWIG, and we got one started down there in about 2007 or 8. And I've been involved with that since then, and we started a local food policy council in our county, and it kind of got started with great passion and then finally failed after a few years. And we had an Iowa Food System Council that got started, and so I guess I can relate to what some of these problems are when in bringing all those people to the table can be. So what I've done is, and I've always thought this way, when I look at my community, I apply the 7 community capitals to my community. And I hope you folks are aware of those, but if you're not, they are financial, built, social, cultural, natural, and human capitals. And if you kind of look at your community that way, you can bring a health perspective to all those different capitals, making a totally healthy community. So the first one is financial. How does a local food system help you financially? Well, you're familiar with just buy fresh, buy local, keep the money within your community. Is very healthy financially. Built capital. How does a good food system affect built capital? Well, we have a food system now that relies a lot on transportation. And if any of you guys are commissioners and have county roads, you know what those big trucks and that big machinery does to your county roads. If you had a smaller food system, a more local food system, your transportation burdens wouldn't be so great. Social capital. Well, we got a lot of that last few years from Governor Secretary Vilsack. You know your farmer, know your food. It's just that thing of a food system bringing people to the table. Let me tell you a story. Several years ago, when Vilsack was presenting to the Senate Ag Committee, Senator Roberts said something like, "Why isn't that tomato that I buy from Texas just as good as the one that I buy here in Kansas?" Well, the advantage of growing that tomato in Kansas is that, Senator Roberts, you probably planted it with your granddaughter, and you probably made salsa with it with your granddaughter, and you had supper with it with your granddaughter. It just brings people together growing your own food. And you probably all experienced that in your mom's garden or even in your own garden. So there's a social connection that we make around our food. The cultural advantage of a healthy food system is the diversity of our crops. Your Latino cultures, your Asian cultures bring all different kinds of cuisine and crops to your community. Natural capital, this one's obvious. We know what our food system now is doing to our water and our soil. We need to be a little more conscious of how we raise our food so that it's a little easier on our natural capital. And human capital, when you bring a bunch of people together and start talking about working on your local food system, you get the dietitian or the nurse involved, you are going like gangbusters. I tell you, those people, they eat your vegetables, watch your carbs. They are a good additive. But when you're looking at all those different aspects of your food system and the health of your community, it's difficult when you have so many aspects coming down to the table. So I hope that Julie can enlighten us on how, when you bring all those people together, how you can have this one common vision of a good, healthy local food system and a good, healthy community. Did I use up all my time? I can tell some more stories.
You were perfect.
There you go.
Great. Thank you so much, Mom. Love those 7 capitals, and I think they can serve us well when we think about how to solve issues. So, great. Pat.
Good afternoon. I'm Pat Harrison. I'm Deputy County Executive in Fairfax County, and my leadership portfolio consists of 9 agencies, health, housing, and a variety of human service agencies. We are a large urban county transitioning from a suburban county, and we're approximately 1.2 million residents large. And of course, we're in the Washington metropolitan area, which in and of itself creates a variety of challenges. Our population is culturally, ethnically, and socially, economically diverse. So we have a significant amount of challenges to try to pull together large numbers of individuals working on large numbers of processes. So I've got a PowerPoint here that I'm going to kind of move through fairly quickly. It's a lot of slides, but I just wanted to make sure that you had a good grounding in what we do. So our local public health system looks a lot like a spaghetti bowl. It's just a lot of different aspects of our community working together, obviously, to keep our community healthy and to work towards developing a healthier community overall. So in 2008, we were awarded one of the community transformation grants, and Fairfax County developed, through that process, developed a leadership approach using a collective impact framework. And to create healthy communities and a better quality of life, to create strong health infrastructure, and to engage the community and create community ownership of our health issues. So in order to make the types of policies, practices, and our environmental changes that were necessary, it wasn't just one approach. In Fairfax County, we're a very, very engaged community. Everybody likes to be engaged. So that is wonderful, but it also creates a lot of challenges in terms of getting alignment on goals, getting individuals to ante up the resources, and so on. So I'll talk a little bit about more of those challenges shortly. But simultaneous to this, the community transformation work that we were doing and the organizing around a community collective impact, we began using that impact throughout the entire system. So I'm just going to give you snapshots of some of the collective impact work that we're doing and the leadership that is associated with that. So the Partnership for a Healthier Fairfax is certainly one of our largest initiatives, looking at collecting a variety of individually operating work groups and committees and umbrelling them all underneath this collective impact around our community health improvement plan. So after 5 years of using this particular approach in a variety of these structures, we know that we have substantially more capacity to make difference in our in the health of our community by using this particular approach and to sustain our momentum. So this has been, This has been an evolution process, though. And, we've got a lot of agency-specific plans. Everybody's got a strategic plan, whether it's government or our private organizations that we may work with. We've got community plans that are focused on specific issues such as suicide prevention or food security, or we're a very engaged community. And then we're evolving to a whole systems transformation and collective impact approach, realizing that if we're really going to pull together all these disparate operating work groups and committees, how do we pull them all together to work towards a common purpose, a common goal, and to attain common outcomes that we're looking to achieve or results that we're looking to achieve for our entire community. So we knew that there was a need for coordinated approaches to the issues. We knew that policy-focused development of those initiatives was absolutely essential. We also knew that we had to have a process by which in-depth vetting of budget and policy proposals could take place. What was the structures that we would put in place to do that? We also looked at multi-sector and multi-system engagement in the planning and implementation of those processes. So it has been an evolution of how we get there. So, oh my gosh, what? So one of the things that we worked with is we developed one of these collective impact leadership teams called the Successful Children and Youth Policy Team. And it really is a leadership group of high-level involvement of executive leadership from the schools, from the county, from our community. And it's sort of uniquely put together because it has also board of supervisors as well as school board appointed members on the board, which I'll talk a little bit about some of those challenges later. In an effort to move this collective impact approach forward, we really began to understand that it couldn't happen without data. So, how's our thinking and planning and working structures change using this collective impact approach? We've come to realize that a single focus, silo structure will not give us the whole community outcomes needed for effective change. We absolutely all agreed that was a problem. So in order to effectively utilize the collective impact approach, we needed to get real about using data to drive the community's discussions, our goal setting, and our decision making. So getting the right data and the most relevant data is always a challenge for us because we literally collect thousands of data sets, but we don't really always know how to put them together. So one example of using that data was in the development of our equitable growth profile and drilling down to what that meant using the child index to really look at where our hotspots were that provided a clear picture of where we should be engaging with the community. And as a result, you can see just from this particular map, the hot spots you can see where in Fairfax County, we may be a wealthy county, but we had definite pockets of areas that we knew we needed to intervene in order to create equitable opportunity for individuals to grow healthy and be healthy for their entire lives. We also used our community health dashboard as another example of driving decisions towards using data to drive our decisions and really connecting those decisions around how do we address health problems that are in our community. The collective impact approach, and specifically our Successful Children and Youth Policy team, worked for almost a year and a half to just get an understanding of why it was important to create a community that was committed to equity. So collective impact is not just an effective tool to coordinate the strategies, because it certainly does that for us, but it also allowed us to get full-scale buy-in from our elected officials and our community representatives around this need for equity. One of the outcomes of this work has been the adoption of a One Fairfax resolution, which directs the development of a racial and social equity policy to be applied in the planning and delivery of all public services. And that in and of itself begins to drill down and create that whole culture of community health. One of the things that we certainly do is making sure that we have the right people around the table addressing those particular issues. You can see that our collective impact approach here involves a lot of different phases as well as a lot of different players. One of the examples that we used most recently, I can give you most recently, was our work with our Successful Children and Youth Policy team addressing a full strategy for the county around early childhood readiness programs. How do we ensure that our children, birth through K, are prepared to be successful in school? What are the strategies that we can use as a whole community to do that? So we have a variety of different operating leadership groups that are fostering a sustainable culture of health here in Fairfax. I've mentioned already the Successful Children and Youth Policy team. We also have Opportunity Neighborhoods. Our goal is to continue to umbrella as many of our work and task force groups as many as possible underneath existing collective impact teams so that we can begin to collect all of the strategies, everybody moving towards predefined goals and objectives that the community has already set. Other operating groups are Domestic Violence Prevention and Protection Coordinating Council. We like long names in Fairfax. Our Diversion First effort is one of our most recent ones, and it focuses on really stopping the pipeline of individuals with mental illness into our jails. And we just had our most recent report out to our stakeholder group and our leadership group, and the results just from a year of working in a collective impact and a full systems transformation approach is yielding phenomenal results. So I'm really pleased with that as being an effort that really promotes a culture of health here in Fairfax. We also have our equity leadership team. This is the team that's really setting that policy in motion, that the One Fairfax resolution that was developed. And we have another most recent one, our Economic Development Advisory Group, which really has embedded health within that economic strategic plan, as well as equity and social justice initiatives. Just some examples, our tobacco-free play zones, our comprehensive policy review, our food council, probably not as robust as yours, but we've been doing a lot of work also in terms of educating the community. The Healthy Community Design Summit was very successful in getting people to envision what our communities should look like if they were really supporting the overall health and growth of individuals in our community. The health impact assessment, this was actually pretty interesting because for the first time, as the Department of Transportation was trying to look at where to put a transit center, they were trying to dump it right into one of our public housing areas that we were already having significant issues with. So the health impact assessment was a way to get everyone to the table and really look at the data that would drive the decisions as to whether or not to put the transit center there, or if we do, how do we mitigate the health impacts that would be resulting in that area. And I'm really pleased to say that that was a group effort and resulted in a very good decision by the group. Some of our challenges and solutions, collective impact work requires a commitment to and responsibility for shared goal setting, shared strategies, shared resources, and shared accountability. It really is a challenge, but it's well worth the effort. The results that we're getting from these various collective impact leadership groups, such as our Successful Children and Youth, have been significant. And it provides. There are really three things that it does really well for us in this venue. It provides full vetting of proposals and initiatives before they reach our various boards for funding. It ensures initiatives have a comprehensive and multi-sectoral approach, and it requires the use of data to drive the decisions and the recommendations. So even though it takes a significant amount of coordination to make this happen, particularly in a county like Fairfax that is very engaged, it's well worth the benefits are well worth what we're able to do if we were continuing in our siloed. So the only thing I really want to focus on here is that it's not just leadership buy-in. We always talk about you need leadership buy-in, but in Fairfax, we not only just needed leadership buy-in, you need to get them at the table, you need to keep them engaged. In our Successful Children and Youth Policy team, we have 1/3 county representative, 1/3 school representation, and 1/3 community representation to make sure that there's a balanced voice in the leadership of the county. But also, it's not just a matter of their buy-in. They are engaged in the decision-making. They are also engaged in having to report the results to the community at large. It's important to have not just leadership buy-in, but also their active participation in our efforts. If any of you would like more information on any of these particular initiatives, I'd be more than happy to send you information on them.
Great. Thank you, Pat. And, I think you've seen from our first two speakers, one who went deep into looking at how a model applies to one area and how you can work across sectors, and then Pat talking about how you create that web, or as she says, spaghetti bowl, of many different efforts working together. And you can see how her collective impact efforts in Fairfax County have been addressing many of those different factors in what it takes to build long and healthy lives, as I showed in that first screen. So really excellent opportunity to see a couple of different ways about thinking about this. So now we'll head over to Washoe County, Nevada, and see which approach or what different approach Kevin will take us through in this topic.
Thank you. Kevin Schiller, I'm Assistant County Manager with Washoe County. For those of you that don't know where that is, that's Reno, Nevada. It's about a 7,000 square mile county bordering Oregon and California. And what I wanted to do, I have some slides, but what I'm going to walk you through is, and this wasn't intentional, but the title of the program I'm going to be talking about is Crossroads, and it's all about cross-collaboration. A little bit about my history. Been in social services. I was in social services for about 20 plus years before I moved into this role. And so the basis of this program really starts back when you go back to the recession. I'm just putting this up so you can see at the onset a little bit of the partnership that has gone on into this program. So you have law enforcement, social services, private providers, Catholic charities, and then various county departments to include our sheriff's office. So the challenge that we had at the onset of this program, when we entered the recession, a lot of people thought I was crazy for wanting to be the social services director. We were going through mandated cuts, had various issues, and the timeline for most social services directors is fairly short, especially when you have child welfare and you have adult indigent services. So what we did is we spent, to give you some sense of the department, we used to spend about $29 million with 34 staff in our adult services division, with the majority of that going straight to hospital indigency. So REMSA costs, hospital costs, you name it. So in most counties where you're struggling with that, you know what I'm talking about. So what we decided to do with the onset of the program was really to take a look at those clients. So what we did is we took the 10 most frequent users of that system. So if any of you have heard of Million Dollar Murray, or that story tied to Million Dollar Murray, we basically took $10 million Murrays and applied them in a system and looked at our costs. So to give you some sense of what we were doing, and I put this up, and I'll come back to it in a sec, but our clients, just so you have a sense, this gives you where we are now. So I wanted to talk about it. We have about 821 clients since the inception of the program back in the recession. With those 10 clients up to that 821, we took those 10 clients, set up a program, and frankly, had quite a bit of lack of credibility with people looking at us thinking we weren't going to be successful. Many of them, when you look at the programmatic structure as it sits today, you have community volunteering, you have clients doing their own work, you have co-occurring disorders, you know, the mental health issues, the substance abuse issues. But when I get into those 10 clients, the one thing that I want to make sure you're aware of is those costs that were associated to the program and those costs that we tied to. So take the jail cost, $128 a day. We're doing it for $26 a day. So to give you some sense of what we saw in the success, what we had to do is take those 10 clients, and the key partnership was the law enforcement partnership. So when we entered the recession, the issue was people that normally had silos were much more open to talking. So the one thing we were able to do is we said, okay, I went to our sheriff and I said, I want to pay for deputies. So we paid for those deputies to apply them into the program. And that was the premier start of that. And that actually originated, if you go back, from a program we had on child welfare side, which was called Kids to Senior Corner, where we had a mobile van where we did immunizations with multiple law enforcement agencies, and that was kind of the carrot to get them engaged in services. Back to Crossroads, when we engaged that sheriff's officer, we also pulled in Catholic Charities of Northern Nevada. That was a nonprofit in our community that had fairly strong foundational support. But what we did is basically found a location, and once we found the location, started building around that. So they live there. They have a Learn to Earn program, which was why I have this slide up there. They work within the program. So many of them are getting skills, and at the same time they're getting skills, what they have to do is transition out of that. Many of them work in the program after they graduate. It's not a traditional treatment program. There's no deadline in terms of the exit. But we've been able to get to, as I said, we started with those 10 clients and have kind of moved out. The cost savings. So I want to talk a little bit about this. There's something messed up on my slide here. So the cost savings. So one thing that I want to highlight in that is those 10 clients, the average cost for one of those clients was $250,000 to $300,000 a year when we broke it down. So when we started evaluating that, one of the key components in terms of that $300,000 is where was it spent? We had some of them 35 to 40 plus days sitting in a jail. 40 plus visits to the jail. So they come in, go out, come in, go out, come in, go out. Same issue in terms of those costs, in terms of REMSA and the transports. We live in our corridor in Reno. We have casinos. Many of them would get picked up on an ongoing basis. Again, the chicken or the egg, substance abuse or the mental health. So once we applied that and we got down to that $300,000 number, we started tracking it. So we started looking at what are those cost savings. So the key piece, when you get to the total, is that first slide shows you the Gold Street, which is that gray house. What I want you to see is that's what's been built out since we started it. So that Crossroads piece now, when you look at the total clients that are within that system, we're approaching 200 clients. We have temporary assistance to displaced seniors. So that's evolved into a dementia program tied to seniors that have dementia and to seniors that are displaced. We have very high rents in Washoe County, so it's evolved to that. Then we've developed an outpatient site, which is our 24/7. You can see that on the blue. You can see the future family shelter. What we're really trying to do is take our shelter that we also pay for, which is just a shelter, convert that to families, and then move the males more into a Crossroads path because those are our most frequent users of the system. We have a river house, which is women. We have a park house, which is veterans. And then we have the Sutro buildings. The key message in all of this for us has been what we've seen in terms of the collaboration. As I said, when I started it, I almost got laughed out of a room as a social services director because people didn't think it could be successful. Now everybody wants to be a part of it. And the momentum side of that has been, again, back to the cost savings, our budget has not increased. So from the perspective of what we were spending on the healthcare costs, we've really basically reinvested those dollars into the programming. And it's much more about the partnership with the public nonprofit, the sheriff's office, and the model. So the sheriff's officer can't be the cop that wants to go arrest. They almost have a component of the social services side in it. But our costs now, when we take the community savings, we're saving about $15 million annually right now. So what's happened is it's just kind of continued to build in that momentum piece. The collaboration obviously was key, but I will tell you, it was all about timing because we had the ability to open the door because we had, and it really wasn't a lot of money, the dollars to go try to support some other departments. So we had interdepartmental collaboration, and then we had the community side of it. So what's really happening now is moving this into a continuum of care. Our goal is really to get up to about 400 clients across those spectrums. And then the piece people always say is, do they just stay there? So the other side of this is we are moving them into housing. So we have people, so to give a couple just quick examples, we have people that were contractors or licensed contractors that had substance abuse or mental health issues. They do all the work in all the facilities. We've been able to work that out with the County Capital Projects Department, all of those things. So everybody that has a vocational issue, we have professors that have been in the program. We have pretty much anybody can think about, seniors. And what's amazing about it is they all are reinvesting back into the program in terms of that market, so they're self-funding the program just by their participation. The last piece that I would highlight, and I just want to put it on this slide, is that's the power of collaboration. When you look at what happens in terms of people wanting to talk to each other, people don't like to talk about money and program, but you got to have one and you got to have the other. And that's been the key issue for us is when you go to the sheriff's office and you say to them, okay, your jail costs have gone down by 2%, working with them to try to invest half of that percent back to that program. We are currently working, we have social workers where we used to have them all sitting in an office. They're all out in the field tied to these campuses. They're in the jail. They're everywhere. So everything is a diversion program. We hold court right on site at these programmatic locations. So anybody that gets arrested, we manage it that way. And then the last thing I wanted to highlight, which I think is really important, is just a stat. This is a come and go program. So they're not locked down, but what does occur in it is they do have a testing program. So in their testing program last year, we did 77,000 tests. We had 34 failures. So what we've seen is really good progress in terms of maintaining the sobriety and being able to do that. And that testing program has evolved, when you see 24/7 up there, into basically an outpatient Crossroads, which has really supported people maintaining their jobs when they are arrested on DUIs and other pieces, because there's child welfare costs. If they can't get out of jail, they can't pay their bills and they can't care for their kids. So that's just a quick snapshot. Thank you.
Great. Thank you very much for that. And I heard lots of examples of direction and alignment and commitment in there, even commitment that might have been generated by urgency. And it's not uncommon that an urgent event creates a sudden need for cross-sector collaboration, but without attention to these kinds of elements, many times it fails. So we're going to open it up to you to see if you have any questions. And we have some microphones in the back, so you can tell us who you are and where you're from, and then if your question's for particular panelists or the whole group.
Hi, Hillary Cooper from San Miguel County, Colorado, in Southwest as well. And my question, Kevin, is for you. It sounds like a fantastic program. We're a very small county, 8,000 people, $22 million budget. And the sheriff's very much interested in getting the behavioral health, substance abuse folks out of the jail. They don't have the capacity to treat, but he's looking at building an addition, a $1.2 million addition onto the jail to have sort of holding rooms. And now I'm starting to think in terms of housing, how we could maybe create some type of housing with those funds, more kind of a permanent situation. So I just wanted you to expand on that a little bit, talk about when those folks get picked up on, on the lane of the gambling places, the casinos. Sorry, we don't have those. They go straight to the housing program, and then they go to court through there. So you're basically bypassing the expense of jail time and law enforcement, or how does that work?
So depending on the level of the crime, it depends. But the majority, when we started this, everybody was passing through the jail and coming back out. So that was the initial component. There's still a component of that depending on what's happening. But in Washoe County, with our sheriff's office, we did not have a vulnerable persons unit. So, some of it is self-experience. So I started as a social worker and worked through to where I was. So I also knew law enforcement officers. So I knew who I wanted in terms of the law enforcement side. In a smaller community, you would too, in terms of how you approach that. But what we ended up doing is we set up a vulnerable persons unit of one that was partnered with the social worker, and then built out from that. So what happened is he became a bridge to our municipalities. So the city of Reno and the city of Sparks are right next to us. So all those law enforcement officers would communicate. So it became a response system tied to those pickups. So we were tackling it at two levels. One, in the community. If we can get them early, so they're not going up to the jail and have to deal with the OR component, we were doing that more often. And then the other side is we were also tackling on the other side. So it's kind of been a convergence of those two. When you give me the number of 1.2 or 1.4 million to build an addition onto the jail, from our approach, what we've really done is we've taken locations in the community. We used our nonprofit as the vehicle in terms of how we purchased those as one of the components, and then build it from there. So that one slide where I had 10 clients, I took my own TV in. That's what they had. So we literally started from a bare bones process and have kind of just built out. Now we have apartment complexes and kind of a phased approach. But I would work with the law enforcement side to see if you can bridge that and try to place them within the community. The key is you got to have people there, both on the nonprofit side and the law. It won't work unless you have the law enforcement presence, and they have to have the right approach in terms of how they interact. But it's been very successful in terms of that. And those 10 clients, when I talk about those 10 clients, when we looked a year later, only one of them had to readmit. So we were really successful in terms of how we managed it. And it's all about their engagement in the program. Once you get them clean and you start figuring out what their mental health is, it works. But the jail side, so we're working right now on a phased approach on those that have the more moderate scale on the law enforcement side. So where they're picked up and they may be sitting in the jail, that's where we've infused social workers into that side of it. So we're getting them out. So we're always assessing is basically what we're doing.
Other questions? Looks like you're taking the microphone somewhere. Okay.
Barbie Robinson, Director of Health Services for Sonoma County, California. And I have two questions. I think the first is for Kevin and the second, or maybe for both of you, Patricia and Kevin. So what was your method for measuring savings? That's the first question. And then secondly, how were you able to ensure that there was sort of the equal shared responsibility and power of the three sectors that were brought to the table for collaboration?
So the data side of it, the first table for our data was our healthcare costs. So that's where we started. Then we built out. So we partnered with the university, and the university became a component of that tracking. So you had jail days, you had hospital costs, you had REMSA costs. Luckily, on the department side, because we had all of that, it was in front of us, so we could use that as the measurable outcome. As it's built out, back to your statement of how do you hold people accountable, the other piece that we've had to really deal with as it's expanded is we'll have sheriff's officers there, we'll have RPD, we'll have all these different entities. The way we've kept them essentially engaged is it's ongoing meetings all the time. And we have an established point of contact. So back to that vulnerable persons unit, he is our lead that directs out. And the way you keep him engaged is the benefit. So if there's a municipality officer responding on a indigent adult, that we're all short-staffed in our law enforcement community. So their benefit is when they reach out, basically it's a benefit to them because they can go on to their next scene. So that's kind of been the direction side of it that we had to maintain, was keeping them engaged with us. The problem we have now, which when you look at all those little circles, the issue now is it's becoming much larger. And so the key component is figuring out who's in charge of what. So we struggle with that. That's a key component. And just like any community, we have lots of nonprofits. We have lots of, if I throw the word housing out, you'll have 15 nonprofits. But it's the issue of you need less chiefs and trying to get it centralized. So that's one of the components that we've used in this that we're now trying to build out. But the data has been critical. So when we track those costs, we are literally tracking them based on jail costs, the medical costs, and the social services impact. So back to my statement on children and families, if we had to place a child into custody, as an example, we're tracking that cost. So we've been able to combine a lot of that.
So we've done something very similar in terms of looking at return on investment. And in some of our collective leadership teams, the issues are much more difficult to track, such as right now we're in the process of looking at our diversion first and looking at our jail cost. But there are so many intangible community cost savings, like the number of individuals that are now coming directly through our recovery center that are not going into the hospital anymore, and what's the return on investment in that? So we're in the process of working through all of that data now. So maybe by this time next year, we'll be able to talk with you about that. But specifically with our Successful Children and Youth Policy Team, looking at one of our goals was to ensure that children were provided services directly in the community. So reducing the out-of-home placements for whether it's foster care or, school IEP placements or whatever the case may be. And ensuring that we're able to serve those children. So it really did take an entire community or systems transformation for us to do that. So it was a very lengthy process of looking at our systems of care. But some of the data that we were able to determine whether or not this was working was, of course, our length of stay, the number of children that were placed out of home and their length of stay, the cost per treatment that was authorized. Looking at the graduation rate of the individuals that, as they came back into the community, what were their opportunities to stay engaged in their home-based school. So all of that is collected. We then, in our Successful Children and Youth, and specifically our systems of care approach, we put about $40 million into serving about 1,800 children it's very intensive. These are children with very intensive needs. And as we were beginning to make this systems transformation, the savings, because we were able to bring kids home from out-of-home placements. So an out-of-home placement for us may cost $300,000 per child per year. The more children that we could bring back in, it saved us money. So we had to build the infrastructure internally in order to do that. So what we were sending them out for, we had to build internally. So we had to, one, know exactly what were their needs and what were we having to send back, and how do we build that then within our own system. So as over 5 years, we have been able to save close to $12 million, and then therefore being able to serve more children in home. So we had to build a whole network of home-based services, but you can literally track the amount of savings, and if you can get commitment from your leadership team, and in this case it was our Successful Children Policy Group, being able to get their commitment to reinvest those dollars in the prevention end as we get further down the stream or upstream from where the problems are occurring. We've been able to put in place a variety of initiatives, whether they were around truancy, whether they were supporting suicide prevention activities, mentoring and after-school programs. So we've been able to invest those dollars back into that upstream process. So if you're able to capture the data that absolutely shows you the return on investment from the community, and you have a collective impact approach where you've got a blueprint for the types of services that are needed in order to get upstream, then it's an easier conversation to have with your leadership team to get their buy-in.
Is data collection primarily then through county or the government-based systems versus community-based organizations or providers?
Well, in our case, both. I mean, we're collecting information from both our private providers as well as our nonprofit providers and on the government structures.
So, Sig Hutchinson, Wake County, North Carolina. And Patricia, you made a comment in your opening comments about how you're having phenomenal success with mental health patients getting out of the jails. I wonder if you could expand a little bit about what type of successes that you're having and what led to that.
Sure, and actually we're so proud of this, and I have Tisha Deegan with me here today. She is our executive director for the CSB, and she's one of the leadership in the county that is moving this effort. And again, this was a total systems transformation to how we developed our services around that intercept model, to how we all now collect the same information, how we report incidents, just even training, making sure that 100% of our public safety workforce have at least mental health first aid training, but then more deeply, 30% of them have CIT training, which is crisis intervention training. So it was a complete transformation of the system. And again, it's very lengthy. We'd be happy to send you the report, the annual report. But just in 1 year alone, we have been able to divert from going into jail, it's close to 350 individuals with mental illness. And they're now getting treatment in the community at our recovery center, but also, and I appreciated the Crossroads example too, because in that particular effort, when you're looking at multi-sector involvement, you get a full perspective of what it takes to support that individual. So we knew that housing was absolutely an essential component. So as we were building out our blueprint of needs and our funding needs and looking at what resources that we could draw from the various agencies, housing is certainly one of them, and I think we were able to obtain about $500,000 worth of housing on an annual basis to support. That's not enough in Fairfax County when you have the numbers that we have, but it's a start to do that. So certainly looking at the recidivism rate too, we now know that of those 345, we've only been tracking it for a year, but at this point, very few have been picked up again for comparable crimes. And we're only at this point looking at low-level crimes. We're getting ready to move into intercepts 2 and 3, which is the jail diversion programs, those individuals who are already in jail. How do we support their transition back to the community so that they're successful and not then re-entering? So we're just in the process of getting that particular part of our model operational at this point. But on the front end, looking at how do you pick them up, really net them as they're having issues instead of at the point of entry with the police or the fire department, picking them up there and ensuring that they're not even taken to jail to begin with, that they're immediately taken to the recovery center where we have police and sheriff manning that center side by side with the mental health therapist. So it's really a collaborative effort. And we'd be happy to send you the report, the annual report.
It's also available on fairfaxcounty.gov/diversion. So all the annual reports and data and story and all kinds of things are there. You can take a look yourselves. And then just write to one of us on that and contact us from there.
Yeah, I'd be happy to provide you. I mean, we're just so proud of that effort. I mean, so for all of you that are in the Stepping Up initiative, I know that you're probably seeing similar results. But ours, really after a year, I mean, using in that collective impact approach where everyone is at the table making decisions and all of your resources, your sheriff is sharing their resources, the police are sharing theirs, human services is sharing theirs, housing, et cetera. So it really has been a significant effort, but it is yielding good results.
Ray Trapp, Guilford County. I have a quick question. I know collective impact has probably been forced upon a lot of people that didn't want to do it previously, but with budget constraints, everybody's looking at that now. So how did you guys start that conversation with folks that had never thought they would have to come to the table with different groups? And a lot of times these folks are competing against each other for grants and for other things. So how did you start that conversation? And then the backup to that, how did you pick the groups that would become a part of your programs?
So I'll go first. That I think probably in terms of the approach and the how, again, it was an opportunity of timing. With the recession hitting, you saw grants going away. We were in mandated reductions. So from a departmental perspective, we were a funder of a lot of different programming, and you saw a lot of that community funding going away. So we used that as the leverage point to get everybody in the room. I made the comment that I got laughed out of the room. Well, I can tell you that was from a provider that wasn't a local provider, that was part of a corporation, and they now are our partner. My point being the issue of that cost savings investment. So that was one side, and then I think in terms of how we picked them, we kind of started from the inside out. We looked kind of in an intra-departmental role. So in the sheriff's office, we have an elected official versus I was an appointed department head, but we started with those that we saw the most ability to create an efficiency, because we were forcing that discussion anyway with the recession. So it kind of built out from there, and then centralized the dollars, and then you know how it works. When people start seeing, oh, that's where the dollar is, it's kind of a trick. You have them chase the dollar, but then you kind of put in your programming and your structure. So that's kind of how we did it.
And ours was very similar. You really do have to capitalize on those opportunities. If you really believe that collective impact will work, if everyone is moving in the same direction, maybe a whole strata of approaches or strategies within that, but you're all moving towards those same common goals. That was absolutely my belief, and all of the Human Services leadership belief that the more people we could get on board the train, the easier it would be. We also were motivated, obviously, because we were, in the last 8 years, we've lost over $61 million out of our Human Services system, and our needs have been growing exponentially. And so so certainly we were motivated, how can we can't do this alone. In an era where, we would make a request of the Board of Supervisors and they would say, hey, yeah, this sounds like a good program, yeah, let's fund it. We knew we could no longer do that. We had to be really intentional about the decisions and using data to drive those decisions. So old programs that have been existing for like 25 years, we had to challenge that thinking. And the only way you could do that is through the data. I remember one occasion where we had one of our programs from our juvenile detention domestic relations courts programs. It was our beta post-dispositional program. They were getting ready to lose funding. They were trying to make a case for continuing their program. And, the leadership team now that is very savvy about using data says, well, what kind of outcomes are you getting? Can you give us a sense of those outcomes? And when you ask people, it's like, you can't just give the feel-good stories. They want real data behind that. So it is shifting the way that you do business, but you also have to understand that it is a systems. Without that systems transformation, collective impact alone is not going to work. You have to be willing to change your structures, to change your processes and your practices, and even the services, the way that you fund programs is significant. One of the most recent ones in our Diversion First initiative, Tisha and I were in a meeting last week with a judge, and she was making the case with her staff in terms of what funding that she was going to need in order to continue this effort, moving into intercepts 2 and 3. And, so here we are thinking, I need more funding. But she did need more funding. But what was really interesting is that she said, I only need this much for us to do what you're asking us to do, but what we need you to do is put the money in the CSB for treatment for these individuals. I mean, it was being able to, again, keep your eye on the goal and then take yourself out of that resource game and say, if I needed to meet that goal, where do the resources need to be? I mean, that was a huge milestone in our leadership for somebody from another agency to recommend funding to another agency in order to make those outcomes work. So it was a sort of it was a moment. We all were like so happy.
And the other thing I would add is that it's the small stuff that you don't pay, when money's good, you're not paying attention. And so I think what I learned, and I just use examples, drug testing. We had all these contracts happening across different departments for various levels of drug testing. When we centralized it, we cut the cost in half with our 24/7 program. So then it starts becoming a benefit by default in terms of that. And much like she's indicating, now be careful what you build. So what happens now is I have multiple departments that we're funding, district attorney, you name it, where we're part of a process. Now you become the fund all. So you have to be careful in terms of, and what I say to people is there's a difference between being a referral agency and being a partner. The partner is where the dollar comes from. So that's a key component. And then the other sell for businesses and private donors, it's talking about the tax dollar. It's making the tax dollar go farther in terms of that, and it's proactive versus reactive. And I think that's much like, we're saying the same thing. The issue of where we go, and obviously much harder than it sounds, is what do we do federally? So in federal cost allocation programming and child welfare, we're dealing with $80 million budget. I'm familiar with 4E. I'm familiar with all the cost allocation, which is a huge part of our budget. But it's very much become, in the line of reactive versus proactive, we need to be more proactive. And I think the same thing exists here, where there's federal grants and incarceration grants and all those things. We need to start figuring out how to do a pilot where we can do cost allocation, because everybody will save money, including the federal government, if we can apply it that way.
Yes, just wanted to make a comment. Actually, my question was answered, but when you take, I guess, like in Fairfax, kind of a super collaborative, and then you think about some of the outcomes that you want to achieve, and how, I guess, what was your aha moment or your blinding flash of insight when you realized that the folks got it? Because when you start looking at collaboration, it is very, very challenging. It's sometimes from communication to cooperation to finally collaboration, and who's going to get credit in that process. But when did you realize that it happened, that people got it, there was buy-in, and I guess basically you mentioned your structure, which is very, very important, and how did it all come together? I guess that's what I'm trying to get at.
Over the course of 5 years, it was a building process. You start, planting the seed. You start sort of forcing some collaboration. You move your resources to where people are demonstrating that behavior, and then you begin to put it all together. So, for example, with the Successful Children and Youth Policy Team, one of the things that we spent a significant amount of time on, almost about a year and a half, is getting the group of, these were school board members, county board of supervisor members, community leaders, businesses, foundations. I mean, it was a whole group of 20, 30 people working together to try to figure out how do we collectively ensure good outcomes for our children. And so one of the things that we worked on for a year and a half was our equity, getting them to understand that if you really want to move the needle on the number of children who are successful in school. We use a variety of data points to track that. You have to look at where the disparities are. You have to. And so getting that very hard conversation around equity, particularly in today's world, was difficult. But it was also taking advantage of what was happening in the rest of the country around clashes between culture and races and so on. So being able to say, in Fairfax, that's not good enough for us. We are an engaged community that embraces diversity. So let's put it in writing. Let's do this. Let's make decisions that are driven towards through an equity lens. So the aha moment was, of course, when we got both boards to jointly endorse the One Fairfax resolution, which is our racial and social equity resolution. And then every single board meeting that we have with them, every committee meeting that we have with the elected officials, they ask themselves, well, in my neighborhood with the equity, if I'm using an equity lens, then I know I need to put my resources here, or I know I need some specific focus on, resources here, or drawing down, a different type of operating structure in this part of my neighborhood. That's the aha moment when they can start to apply a tool that you've used in your collective impact leadership groups.
In terms of, I guess, doing the first thing, maybe a quick success type project, in terms of looking at a very big picture piece, looking at the entire systems approach, how did you go about deciding on which would be the first project to get people to the point that they saw some results? Because in a lot of cases in vulnerable communities in particular, there's just so much studies and nobody ever sees the result. So how did you prioritize, decide these are the first couple of projects that we're going to do because they're manageable within the big system piece?
And that is that's the big question, is getting, because all of this, we can come up with all the plans we want, but if we can't give our elected officials, a sense of the priorities and the urgency of what we're dealing with, then it's difficult for them to make decisions. And in addition to that, our elected officials were saying, Pat, Human Services has so many needs. Where do we begin? And so part of the process of getting your leadership around, really coalescing around specific goals, is also getting them to identify what are the critical factors that you make decisions around. So, for example, with our early childhood readiness initiatives that we put in place as a result of the Successful Children and Youth Team, one of the things that they absolutely knew that they were going to impact, because we'd already gotten them to the point understanding that you really do have to get downstream. You really have to start with the babies and then move up if you're going to make an impact on academic success. So how do we impact then our waiting list? We have large waiting lists for our Head Start programs. I mean, we were up to over 1,000 children at one point waiting for a placement in our Head Start. So by looking at how do we utilize, the school's resources, the community's resources, and our own resources in county government, setting that goal, saying, okay, now we all agree that this is one of the areas, because of its potential to impact everything upstream. We've really got to start here. Getting them to those decision points was really hard, and we had to actually bring in, we tried to do this unsuccessfully ourselves, trying to facilitate that conversation, and we had to invest in, a facilitator from the youth forum to come in and really facilitate that conversation. And so now they at all of our leadership team meetings where policy is set, we have a facilitator come in and specifically do that, because that is the only way we were going to get people to the point where they left the meeting with a prioritization and with decisions made.
Very helpful.
Well, I know we're coming to the end of our time here. Thank you all for your questions. Clearly there is a lot of wisdom on our whole panel. And a reflection I have as I listen to Kevin and Pat and our commissioner auditor, Melvin, sorry, who's left us, is none of this happens without leadership. And I want to thank each of you for the leadership you've shown. I mean, leadership like you take your TV to the first home and make sure there is, I mean, that's leadership. Leadership to be willing to get your hands messy in that bowl of spaghetti and keep at it. Leadership. And clearly, I think the second thing that I heard really consistently from both of you was persistence, that this doesn't happen overnight. And third, data-driven, that data led you to those priorities, which I think is also part of the answer here, and data led you to your success because you knew what it would look like and you knew how to measure it. So thank you very much. As we close here, I want to give each of you one chance to give your one pearl of advice that you would give to this audience, who clearly are people still here at 4:30 at the end of a long day trying to think through this process. And so what's your one pearl of advice you give to the folks about what's most important if you're going to do cross-sector collective impact type work?
Wow. Actually, I think you said it best in terms of persistence. And that is a quality that I have. I will wait them out. The resistance that they may have. You just keep plugging away. If it doesn't work one way, I do it a different way. And eventually, everyone seems to come on board and working together. So really, but that takes a lot of personal fortitude. So persistence, I think, is the key.
And I would say, do it. I think a key factor is don't do it like you've always done it. It takes a step of courage to do it. And speaking, I have very supportive county commissioners in a time of crisis financially, so that was an opportunity. That persistence piece, I think, is critical. And I think the other one is make it their idea. That's a big one. Don't that issue of claiming, it's my program. It's really our program, and that's one of the key components we focus on. It's the client's program too, and that's really what's critical. But I think those are the pieces I would say.
Well, if we can give a round of applause once more. Thank you to our awesome presenters here, and thank you all for your attention. And have a wonderful evening.